up with people coming in and out of our house day and night. It's not fair. Samantha, it's not on, is it?
I know exactly what you mean. They disturb my football. They come as it plays. It suits them. It seems to suit them, not Samantha.
Some of the carers come in so rude, on their phones, never do anything for Samantha. Look at her, she doesn't even talk anymore, she's so depressed.
Well, I've come to let you know that I know someone who's got a personal health budget.
What's a personal health budget?
Well, if you phone your social worker up and ask, they should be able to help you with it.
Ooh, Samantha, it might be some good news for us.
The Archer Swifts are not happy with Samantha's care. They have been told about something called a personal health budget. A personal health budget is an agreed amount of money to support someone's health needs. The budget is discussed and agreed with the NHS.
Hello?
Hello?
Hello, my name's Mrs. Archer Swift. I'm calling for you because I'm not happy with the care what Samantha's getting at the moment. I heard about this personal health budget.
Well, I'm glad you have rung because Samantha is due for a review, and this is a good opportunity for us to have a look whether her needs have changed and whether a personal health budget might be suitable.
Oh, that is good news then. Oh, Samantha, I think we might be going somewhere, love.
When can I visit?
Oh, tomorrow will be fine. Thank you, bye.
Bye.
Oh, Samantha, wait till your dad comes home. We can tell him from fishing what he's going to go ahead.
The social worker and family think a personal health budget might be a good idea. They arrange to have an assessment with a nurse from the CCG.
Hello, I'm the nurse practitioner, Catherine.
Hello.
Are you Mum?
Yes, I'm Mrs. Archer Swift.
Lovely to meet you. You must be Samantha. Nice to meet you, Samantha. And so your dad?
Yes, nice to meet you.
Oh, well, thank you for inviting me.
That's okay.
So, I've come to tell you a little bit about personal health budgets and decide whether you want to have an assessment for one.
I read in the newspaper that people are using it to pay for rides on pedal boats. Can we have one of them?
Everybody's assessed differently, so depending on what Samantha's needs are, then we can look at what the best outcomes that we want to achieve for Samantha are. The reason that we're doing this is because people with long-term health needs are taking up 64% of all outpatient appointments and 70% of inpatient beds. So personal health budgets is really to try and reduce the pressure on the NHS and actually get people that have got long-term health conditions more active, more healthy and living longer. So, you know, if there was something that we assessed that would meet Samantha's outcomes, then I'm sure that would be absolutely fine.
At the moment she has 5 care calls a day and it must be costing a fortune, but she gets very little out of it. The staff barely have time to do the care duties before they are called away.
So shall we get on with the assessment now?
Oh yes, what do you think, love?
I think, yeah.
Yeah.
It'll make Samantha much more happier.
Let's put a smile on the face now.
Yeah.
Fantastic. So let's get on with the assessment then.
Yeah.
Personal health budgets can help to give people with long-term health conditions and disabilities more choice and control. It's not about new money, but spending money differently to meet an individual's needs. Currently, adults who are eligible for continuing health care and children with continuing care are eligible for a personal health budget. During 2015-16, local CCGs will be expanding their local offer, which means more people will be eligible. To find out more about personal health budgets, go to www.england.nhs.uk/health budgets.